Brooke Catrola has been a dancer since the age of 8. She's always been a little bit of a health freak, an active person. So when she enrolled at Texas Tech University, she joined the Pom Squad. It was a natural fit for her. She grew close to her friends and fellow dancers. And then, as she puts it, things got a little weird.
I just felt like something was off, but I didn't really know what it was at the time. But I just got really tired all the time.
When Brooke came home after spring semester, things got worse. Headaches, fatigue. Her mother, Deanna, kept a close eye on her.
She just kept going downhill since she came home. So I sent her to the eye doctor, and the eye doctor dilated her eyes, and both her optic nerves were swollen. It took us like 2 weeks to get a neurology appointment. You can't just walk into a neurologist. If something is wrong with her, why am I waiting to go see this neurologist? What if there's something really wrong with her? And so I had just snapped, basically, and we went to the ER that evening.
And then I got diagnosed with a 7-centimeter brain tumor.
Brooke and her mother could see the brain tumor on the MRI. It was large.
You can't believe it. Yeah, you can't believe it. You're just in shock, honestly. Is this really happening? Like, does this really happen to a 20-year-old?
After the diagnosis, they went straight to MD Anderson Cancer Center, where Brooke had brain surgery a couple of days later.
It was really scary, and I was scared to honestly die, or I was scared I had just a couple months left to live, but I still have a decent chunk of tumor left in my head.
You just hold your kid's face and you say, we got this, it's gonna be okay. And then you figure out what to do next. And honestly, it's kind of been moment to moment ever since.
Brooke found a supportive team at MD Anderson. Her surgeon was Dr. Fred Lang, now chairman of the Department of Neurosurgery and a leading researcher. His early clinical studies had included treating patients who had glioblastoma, the most deadly form of brain cancer, with a virus injected through the skull directly into the brain tumor. The virus, called Delta 24, was engineered at MD Anderson by Dr. Juan Fuejo.
When we learned in our original trial that the virus activates the immune system, Dr. Fuejo re-engineered the Delta 24 backbone. It looks like that can activate the immune system, so that we think can now potentially transform this therapy from, affecting maybe 15 to 20% of people, hopefully up to 50 or 60% of people. So we think that's groundbreaking and changing the whole field in the way we look at the problem.
In future clinical trials, stem cells from donors will be loaded with the new virus, and using special catheters that are threaded up through the arteries, the cells are injected directly into the blood vessels, feeding the patient's tumor.
If we can direct it specifically to the arteries in the tumor, we can open up those arteries, overcoming what's called the blood-brain barrier, which was one of the biggest problems with brain tumors, and then deliver an agent that targets the tumor itself. That whole idea really transformed the way we're starting to think about the best way to treat these tumors.
The advances made by Dr. Lang and his team have been made possible in large part by support from the Broach Foundation for Brain Cancer Research.
Broach Foundation money is probably more important now than ever, particularly for things like our virus, where we're getting to the point where we actually are understanding the manipulation of it.
The foundation was started in 2011 by James Broach, a glioblastoma patient, and his wife, Jamie. After James lost his life to the disease in 2013, Jamie has carried on the mission.
He really just wanted a couple of things. He wanted to be able to help other people so that they wouldn't have to go through what he was going through. And he wanted to make sure his life and legacy lived on through the boys' lives. And I think the foundation helps accomplish both of those things. We have amazing donors that come back every year and help fund research. I can't thank people enough. And I think James would be so touched by their generosity and their support. And then I also think he'd sit back and he'd look at all the progress that's been made and think about the fact that there's still not a cure. And I think really he'd say it's not enough, that until a cure is found, we have to do more.
The support from the Broach Foundation gives hope to patients like Brooke, who are in the fight for their lives and who, along with their loved ones, will never give up.
People are always like, why are you so positive? And I'm just like, I mean, this is my life and you can't just be sad all the time, and it's not gonna help to just be stressed about it all day long, and I'm doing well.
Even though there is this grief of having to deal with this in our life, because no one wants to deal with cancer, especially with a 21-year-old. Even though we're dealing with that, we deal with hope and strength right now.
Why I really continue this foundation and what keeps us going is the hope that it can provide patients, that a cure is on its way. We wish it were here yesterday. It won't be here tomorrow, but hopefully very soon.
Research is part of the lifeblood of MD Anderson's mission to eliminate cancer. The Broach Foundation continues to be a major supporter of Dr. Fred Lang and his team. All of us at MD Anderson offer our appreciation for their impactful support.